Concerns surrounding COVID-19 are becoming more evident as cases are confirmed in Minnesota. This evening, we want to answer some of your questions about the virus. So to help us separate fact from fiction is Dr. Tim Seeloff, who is a Chief Medical Officer with Allina Health. Thank you so much for joining us, Dr. Seeloff.
You're welcome, my pleasure.
We were talking about the anxiety. I know we reported earlier 2 people in Minnesota testing positive for COVID-19. I think one viewer wants to know if someone gets COVID-19 and recovers, could they get it again a few weeks later?
There are some reports in the literature of patients that appear to have reinfections, but it may also be the case that they just have sort of recovered incompletely from the infection and its symptoms have come back. So it's not clear that people get reinfected yet, and it's very rare even when that does happen.
Well, typically, how long does it last if you get COVID-19, the virus?
It can last from a few days to over a week, closer to 2 weeks, and that depends on how ill one gets. So patients that have respiratory failure and need hospitalization will be on the longer end of that.
Well, I know another question from a viewer, are children less affected than older people?
It seems to be the case that children are less frequently infected, and that has also been seen in other corona-type viruses in the past. And it is certainly the case that older people are more significantly affected, and that's one of the reasons why the public health preventative measures that have been talked about are really important, and that's why there are evolving travel recommendations for older people. So people that are over 65 who have heart disease, lung disease, diabetes, or combinations of those are going to be at significantly higher risk.
And we talked a little bit about the symptoms. We said they're very similar to the flu, except for the shortness of breath. And that seems to be more of a sign of COVID-19. So should we be more concerned about the flu here in Minnesota than COVID-19?
Well, I think if there is a good thing, the good thing would be that the preventative measures for the flu are going to help you with preventing coronavirus. So social distancing, keeping your hands clean, not touching your face if you're ill, isolating yourself, all of those things will work for preventing transmission of the flu and COVID-19.
What about masks? I know a lot of people, they're selling out of masks. Is that a preventative measure? Does that help you at all?
No, the vast majority of masks have no effect on droplet transmission. And so if you're not ill, wearing a mask won't prevent you from getting ill. If you are ill, it is a good idea to wear a mask to help reduce the spread of the droplets. And if you happen to be caring for somebody who's ill who can't wear a mask because of shortness of breath, then wearing a mask might be helpful for that individual. It's really important to save those personal protective equipment resources for healthcare providers.
All right. Thank you so much for joining us. And of course, you're going to answer some more of our questions coming up this evening at 6.